I had the misfortune of pretending to be a quarterback and tripped, and I broke my wrist and ankle at the same time when I was 20 years old in college, and that was a very interesting experience. I ended up being in a long arm cast for 2 months and then a short arm cast for another 2 months, so essentially 4 months in a cast until everything healed. And now that I'm an orthopedic surgeon, that experience actually makes me somewhat more empathetic to patients and understanding when they say, well, I can't do this with this treatment, or understand the impact of even small things such as a cast that might have on a patient. I'm Dr. Ali Motamedi. I'm an orthopedic surgeon at Ventura Orthopedics. I'm board certified in orthopedic surgery and sports medicine. So I've always been exposed to medicine. My father is a doctor, and from early childhood I was exposed to him and his friends and colleagues. As I was going through different options in medical school, we had opportunity to take elective rotations and work with different subspecialties. And I did a rotation in the trauma service with the orthopedic surgeons. And what was fascinating is that they were working the hardest of any other resident. They were up all night many times operating. But it seemed that they were the happiest people in the hospital, and they loved what they were doing. So I became really intrigued with the fact that these are so happy people taking care of these patients. I became interested in sports medicine as I was going through the field of orthopedic surgery during my training. I found out that you could have the biggest impact in that field. You have patients who come into you in literally a millisecond, their life and career ends, and you are able to, within 2 hours of surgery and 6 months of rehab, get them back to that high level of athletic activities. So to me, that was such a powerful thing that you could have and help people with, that I realized that I had an interest in. The scope of my practice is essentially general orthopedics. Anybody with a musculoskeletal complaint, from the neck to the toe, I can evaluate and see what the problem is. My surgical and elective practice is mostly concentrated on sports injuries, specifically shoulder and knee arthroscopy. I've been in practice now for 17 years. What I enjoy the most is coming to the office, working with a great group of people. We are very efficient, professional, but at the same time enjoy working and have fun, and that just keeps me going every day. And I like the fact that the patients here are very motivated and interested in their care. They want to know what's going on, and I can help them, and that keeps me going. My approach to the patient is to get as much information as I can of what the impact of this injury or potential disease has on their life, and then try to listen to their concerns of what they need to do to get back. And a simple question I sometimes ask a patient is, what is it that you can't do because of your knee pain or shoulder pain that you want to do? And that gives me an insight to their feeling of how much this injury has impacted them. So I think when I approach the patients in that regards, they feel safe and open communication with me to discuss how they're impacted by this and help provide their care. I grew up in Iran with my family, and we migrated to the United States all at different stages. It took about 6 or 7 years for all of us to get here. Growing up in Iran was great. I was a kid with 2 brothers and my family, and we lived in Isfahan, which is the second largest city in Iran, and we just had fun. It was a great time. It was no different from the life of a person here in the United States. I had grown up in an American school, so I had many American friends and multicultural family, so I was used to, and I spoke English, so that part wasn't that difficult. It was a relatively normal childhood, nothing different until the turmoil happened, and then that was obviously resulted in our family being separated and the migration to the United States, which eventually turned out to be an amazing opportunity. I have a 10-year-old son. Most of my time outside the hospital is spent with him doing kid stuff, playing tennis, going to the beach, riding our bike, and occasionally traveling to see cousins and family members up in Northern California. So it's very enjoyable, and that's what I work for those weekends off, so I can go and be with my son.